listening to the myPET podcast, the show for pet lovers of Australia and around the world.
You're listening to the myPET podcast. I'm Aria, and I'm here with our resident veterinarian and Dalmatian dog dad, Dr. Glenn.
Hello.
How are you doing?
Good.
That's good. Before we get started, just remember that this is just general advice. So it may or may not be suitable for you and your pets. If you have any specific questions about your pet and using what we're talking about, have a chat to your vet.
Sounds good.
So what are we talking about today?
Probiotics.
Oh, yeah.
Lots of bugs.
Lots of bugs. Not like literal like beetles, right?
No, just little microscopic bugs and fungi.
Oh, fungi.
Yeah.
Fungi is cool. So you say fungi, not fungi?
Probably.
Yeah.
That's what I say.
So fungi are fun guys.
He's a fungi. Yes.
Yeah, cool.
Yeah.
So I guess what are probiotics really?
Probiotics are lots and lots of bacteria. Sometimes they're yeast that basically we feed to people and animals to hopefully promote a better gut biome. That's the whole theory behind it.
Yeah.
And the gut has got lots of bacteria and yeast in there already, and we're just trying to change and modify the ratios of the good bugs and the bad bugs, basically, is what it comes down to.
Yeah, cool.
And sometimes that's probably successful and sometimes it's probably completely unsuccessful.
What are the benefits of having this good gut biome?
Depends on who you listen to.
Okay.
It can either save the world and create world peace or probably not do much at all, depending on who you listen to.
Yeah.
Because the gut's not a sterile environment. The further you progress down an animal's gastrointestinal tract, the stomach is a very inhospitable environment for bacteria and yeast to grow.
Yeah.
But the further you go down the small intestine, hopefully there's not much bacteria and yeast in the small intestine, bottom end of the small intestine, top of the large intestine, bacteria and yeast become very dominant and very important as part of the normal biological processes, both making nutrients out of the food that they are digesting, because animals and people don't just digest food through enzymes, they digest food through bacterial and fungal growth, basically.
Wow, that's amazing.
And all those byproducts are sometimes absorbed as a nutrient, and sometimes they go to feed other bacteria and yeast and be part of this whole microbiome, which is really, really important.
So like me and my dog have a bunch of teeny weeny little microorganisms helping us to be healthy, and
hundreds of billions of them, yes.
Wow.
Yeah. And they've all got a little place, and the more we learn, the more places that they actually are, because we used to think that the intestinal lining was like a block to all things living, basically, that only let nutrients and amino acids and fats and that sort of thing through. And we used to think that all the bacteria stayed in there, but basically that's nothing like the truth. Like, the bacteria get through the gut wall and they get absorbed into the system and they go up the vagus nerve and affect how your brain works and all sorts of things.
Wow.
And there's bacteria throughout the body, through all the organs, hopefully the right bacteria that are supposed to be there.
Cool. So probiotics is putting more of these cool guys in there to help do this.
Yeah, basically you're trying to tip the numbers of favourable organisms in the right direction. So there's literally thousands of different types of bacteria and different types of yeast in the gut. So probiotics basically, the most bacteria that's probably in a single probiotic is 9, I think, off the top of my head, different types of bacteria, but they can hopefully survive the passage down through the stomach and survive the stomach acids, and some of them at least get to the reproductive stage and take up places like on the gut lining to try and keep the bad bacteria out, like E. coli and salmonella bugs that can actually attack and colonise the lining of the gut, but also affect the way that nutrients are digested and absorbed.
Okay.
Yeah.
So what about prebiotics? What are they?
Yep, so prebiotics are the nutrients that the bacteria and yeast that are in the gut eat, basically. So they are either a direct food source or they're broken down by other microbes to become a food source for yet other microbes. So there's lots of interdependent relationships there, and the prebiotics are hopefully the food source for the good bugs as opposed to the bad bugs. But depending on what your problem might be, like if you've got a small intestinal bacterial overgrowth or SIBO, giving prebiotics might be the wrong thing because your gut isn't working properly and the bugs are already there. And if you give more food to the wrong bugs, that could be a bad thing as well, which is where it gets really complicated with like being able to prescribe or give as a supplement prebiotics. Most of the time it will be the right thing to do, but some of the time it could be the wrong thing to do. But how can you tell which that is the complicated part.
And that's where you talk to your vet.
Talk to your vet and they'll have some idea, but I mean really a lot of these things are just tried as well sometimes. Yeah, and it depends on what specific condition you're trying to treat as well. Because I mean prebiotics and probiotics are part of a supplementary treatment for a lot of conditions, but they're rarely the only treatment. But sometimes they are the main treatment, like salmonella as a gastrointestinal infection. We used to try and strafe bomb everything with antibiotics, and now that's probably not the right thing to do. It's probably just promoting the right bugs that are supposed to be there, and the salmonella goes away because they were caused by usually an unfavourable environment in the first place, unless you get a super infection from somewhere, unless you're immune compromised because of other disease, and it gets complicated.
Like I guess we kind of have like a personal history with probiotics being really useful with my little dog Shadow. So I had a little dog who had inflammatory bowel disease, and it was pretty nasty for a while there. And you got us onto probiotics, and golly gosh, it made a huge difference in him, didn't it? I
mean, inflammatory bowel disease is one of the conditions that massively important to get as many good bugs in there as possible, because it's an overgrowth of the bad bugs, and there's inflammatory bowel, and then Campylobacter and Clostridium perfringens, like some of these specific bacterial infections that you can actually test for. A lot of the treatments have really become trying to boost the prebiotic and probiotic profiles in that gut to try and get things working well.
It's really amazing. I didn't actually know that the prebiotic was the food. That's incredible. So I guess we touched on a little bit of when to not use the prebiotics. When should we be using probiotics?
Look, probiotics are probably a good idea to use after an antibiotic treatment, not during an antibiotic treatment, but after an antibiotic treatment, because you've just killed lots of bacteria, both good and bad, with an antibiotic treatment most likely. The caveat to that is there was a study in 2018 in people that suggested that giving probiotics post-antibiotic treatment actually slowed down the recovery of the normal gut microbiome, so that's a complicator, and it depends on you can make theories about everything that skews it to the way you want it to work. So if you've killed everything with antibiotics and you give probiotics straight after, we're giving 10 types of bacteria or 3 types of bacteria, are they taking up more space than they should and not allowing the 3,000 different types to grow back? It's a hard one. I mean, that was only one study, and there's been lots of other studies that suggested that probiotics are successful and important post-antibiotic treatment. I mean, I still favour them post-antibiotic treatment, certainly. And there's one type of probiotic that you can give during antibiotic treatment that's a pause SB, so it's a Saccharomyces, it's a yeast, so it's not actually killed by antibiotics, and that particular type of yeast has been found to promote more normal gut health and suppress diarrhea, and particularly diarrhea during and post antibiotic use. But that's the only one that's commercially available that we can find in Australia that basically does that job. But that makes it very important potentially, if you've got a dog that's on a protracted antibiotic course. I mean, osteomyelitis and different infections, like you might be on a 6, 8, 10, 12-week course of antibiotics. If you can give them gastrointestinal support through the right yeast that could help prevent diarrhea, or if you've got a dog that needs to be on antibiotics but also gets diarrhea from antibiotics, that's something that can help.
That's really cool. What about other times other than the antibiotic thing?
So I mean, older dogs certainly lose to some extent their gastrointestinal integrity, and they just don't digest things as well, and they can potentially benefit from that sort of support. Specific diseases like inflammatory bowel disease, certainly pancreatitis, we think there's probably a part cause in there as far as ascending bacterial infections, and it really modifies the immune system as well, like the right bacteria in the biome feeds the right bugs with little lipids and the molecules that get absorbed across the gut that actually affects the immune system as well, and right through to digestive health and health of the brain and nerve function and neurotransmitters that get uptaken from the gut that work on the brain. So
this is so systemic, isn't it?
So if you've got a dog with a anxiety disorder or a mental acuity issue in their old age, okay, could better gut health help with that, potentially. Just
to kind of try to translate that into layman's speak. So the lipids are like a fat that takes that moves things through the cell wall. Is that right?
Yep.
So those are taking these good bacteria and kind of moving them all around the body to do these different functions.
Or the byproducts of bacterial growth. So like the waste products are actually absorbed into the body and used to make neurotransmitters like tryptophan is a precursor for serotonin, which is a brain feel-good neurotransmitter.
Yes.
Well, that tryptophan is basically gut-derived nearly all the time. Like if you eat the turkey at Thanksgiving and fall asleep afterwards, the theory is the tryptophan in the turkey, and turkey meat's really high in tryptophan. Okay, that induces a happy sleep-like state, and that's not the tryptophan feeding through the serotonin pathway. So, there's lots of interactions that we barely grasp, basically. Yeah.
I think this is the kind of thing that in years to come we're going to find out a lot more about.
A lot more. I mean, we know more than we did 20 years ago, but we know less, probably. Because
that's it.
The more we know, the less we know.
Exactly, yeah. It's still really, really fascinating.
Yeah.
So when not to use probiotics?
I mean, basically, small intestinal bacterial overgrowth, SIBO patients, and that's going to be diagnosed by your vet through various means. They should probably not get probiotics, and if you obviously have an adverse reaction to them, like some dogs, if you start them on a probiotic, they'll get diarrhea. Was that the probiotic or was it something else? Hard to say, but specifically don't use any probiotics at the same time as you're giving antibiotics unless you're using the pause SB, which is suitable for using with antibiotics. That's the main caveat realistically, or obviously on the advice of your veterinarian.
Yes. Yeah. So you talked a bit about the poor Digesticare SB.
Yep.
So that's the one that's based on a yeast that you can give when you're on
antibiotics.
Antibiotics. That's really cool. What other probiotics do you want to touch on? Like what products are available that are good?
I mean, Pro Nature, which used to be called Protexin, has been around in Australia for 20-something years, since I've been a vet just about. And it's a very good blend of the various probiotic bacteria that should be in there. It's got lots of different formulations as far as liquids and powders and little granules that you can put in with food. So different routes of administration, as in, put it in there, mix it up with their food or sprinkled in their food or down the hatch, basically. Like there's different administration routes for that one, which is suitable for some people. Probably the two other main ones that I use in practice is the Big Dog Probiotic. It's a probiotic and a prebiotic blend. It's also got digestive enzymes in it. And look, the addition of digestive enzymes, if you're treating a patient with like pancreatitis or inflammatory bowel disease or chronic pancreatic exocrine insufficiency where the pancreas doesn't work properly, or they've had multiple bouts of pancreatitis, if you can help digest that food and make everything work better because you're giving the right bacteria, you're giving food for the right bacteria and yeast, and you're also partially digesting that food and making it more available, I think that certainly is beneficial. So the Big Dog Probiotic and also the Symbiotic 180 is similar in that they've got a good range of bacteria. It's got the prebiotic, but it's also got the digestive enzymes in it. Yeah, so that's good. And the Symbiotic 180 is also water soluble. So if your pet's just been in hospital, they're still feeling a bit sick, sometimes they're drinking but they're not eating that well, and maybe you don't want to mix medications or anything in their food that sort of puts them off it a little bit.
Yeah.
The water-soluble one makes sense because you can put it in their drinking water, so they're getting it that way, so you don't have to sort of adulterate their food if they're still feeling a bit crummy for dogs and cats.
And so speaking of which, these are suitable for a wide range of species, except I think the big dog's only dog specific. Is that right?
I think so, yes.
Yeah. But the others, I know Pro Nature has, it can be used for many, many different species.
Can be used across the board, and that's the hard part, because there are species-specific bacteria potentially where a species-specific probiotic maybe could be manufactured, but most of them are across the board for different species, and you're not going to cause any harm to other species by giving them, but it may not be actually species-specific as such.
Right, okay.
Yeah.
That makes sense.
But no, I mean, for me, nearly every animal that's got anything wrong with them could potentially benefit from probiotics unless there's a specific reason not to.
Yeah.
And I mean, the more we know about the elderly pets, basically, I mean, they could probably benefit from it, like just in addition in their food all the time, just to try and keep everything work as good as possible. And really, the more we learn about immune system modification and how probiotics can potentially support immune system function, I mean, that becomes very important as well, because I mean, normal immune system's important as far as fighting off viruses and bacteria, yes, but also what role does it play in cancer and the normal biological pathways in the body to nip cancer in the bud in the first place. And I'm not saying that probiotics will cure cancer or prevent cancer, but it's very unlikely to do any harm, and the closer you can have the gut functioning to normal, I mean, it only makes sense that it can work better. I think it's been good for like young dogs as well, like people who have maybe pups who've come from a rescue who've had a bit of a rough start. Absolutely.
That I've know a few clients and people who found success with that as well.
And a lot of those dogs that haven't got a specific and cats for that matter, like a specific problem as such, but they just got that like sensitive guts, like they're not haven't been diagnosed with inflammatory bowel disease, but it takes a very small dietary change to upset them. I see a lot of those patients that you put them on a probiotic all the time, or you put on a probiotic if you're going to change their food, they seem to get less of that gut upset, and that makes sense as well. But the fact that you've got a dog, because dogs eat all sorts of stuff more so than cats, if your dog has got a sensitive stomach but hasn't got an officially diagnosed disease, I think probiotics all the time in that dog makes sense. And things like hemorrhagic gastroenteritis, which is a different gut upset condition. I've got a couple of patients that they get one bout and then they get another bout. A couple of months later, you stick them on probiotics all the time, and it seems to happen with less frequency, or it goes away. So there's something there. And it's not going to do any harm.
No, that's wonderful. Is there anything else you want to touch on with the probiotics and the prebiotics?
I think that pretty much covers everything. I mean, it's a massive thing that there's not a lot of proof out there for definitive things, but there's lots of scientific studies, but it's such a complicated thing. Like most of these bugs, you can't culture in a petri dish because they've got to be in the presence of 15 other different bugs and the food sources that they give, and that's where the bugs that actually are in probiotics, realistically, they're the ones that you can culture outside the body. So, I mean, the lactic acid forming one, like a lot of them are based on the milk fermentations, like the lactobacillus and that sort of thing. You can manufacture them, you can make them outside the body. And the same with the yeast, and the same with the soil spore forming organisms. You've got to be able to make them to put them in something to start with, which is a limited field of bacteria in the first place, which is where the prebiotics become important, because the food for the gut can grow its own bugs.
Why is there a need for us? Is it because of like a lessened food diversity, or do we not really know why?
We don't really know. And
where would this have come from with animals in the wild?
Well, I mean,
or is it something that wouldn't, and that it's beneficial for them because?
I mean, would wolves benefit from having probiotics? Maybe, but a wolf's diet is a lot more diverse and a lot different to a manufactured pet food diet. And dogs aren't wolves and wolves aren't dogs.
No.
And there's been genetic diversification over time, and domestic dogs have got a lot better at digesting complex carbohydrates, because you look at their DNA, they've got a lot more amylase enzymes and that sort of thing than wolves. But I mean, dogs, they still came from wolves not very long ago.
Yeah.
And looking at a completely manufactured kibble or canned food diet, I mean, it's got a lot of the different nutrients to what a wolf would eat in there, and it's been heat treated a couple of times. And like, what does that do to the bacteria food sources that should be there? And that's the thing that we don't know.
Yeah, okay.
And there's veterinary prescription gastrointestinal diets and that sort of thing that have got lots of, like, they've got prebiotics added, and they've got things added that normal foods haven't got, that makes them better and less likely to cause gastrointestinal upset. So that's what we feed to pets that have got a history of gastrointestinal disease. But is that because the right stuff isn't in there in the first place, or it's in a form that's been modified that much that the bacteria can't recognise it as food? So then you get more likelihood of gut infections. But then if you're eating raw dead animals, well, you've got more salmonella and E. coli and everything else as well. So yeah, look, it's bloody complicated. But it's, when you think about it, cats and dogs are the only animals that we feed a completely manufactured diet to. I mean, cattle in feedlots, you could argue, aren't necessarily the healthiest specimens of the cattle world getting their diets. And there's lots of talk about, intensively managed livestock isn't the healthiest thing for them. Our cats and our dogs are the most intensively managed livestock that we've got, because they've got such a, in general, diet that's highly manufactured and changed from what they're probably supposed to eat.
Yeah.
So, yes, I mean, all that's involved, and what the actual answer is, I'm not sure.
Yeah.
But looking at diets of every other species as close to natural as possible works best, whether you're talking about people or horses or cows or lions in zoos and stuff. They try and keep it as natural as possible. Dogs and cats are the only animals that we really don't feed naturally. Yeah, in general.
Because I heard about a study where they the people who sort of lived off the land had a much greater diversity of
absolutely.
Gut biome than someone like me who doesn't.
Well, and that's because of their diet. I mean, when they look at and that's the complicating factor, like the Inuits, Eskimos in the top end of the North Pole. I mean, they really only eat meat and a bit of seaweed when they can get it in the middle of summer when everything thaws out. Yeah. So they've got a very undiverse diet, but they've still got lots and lots of gut diversity happening, as opposed to people that live in the Congo or the Amazon rainforest. They're eating like 130 different plant species over the course of the week, and eating 15 different animals as well. So diversity must be part of it, but it's probably more so what's natural versus highly processed and all the other bits and pieces. Yeah, so
it's very
hard.
Complicated.
Yeah, I mean, that's why we fortify breakfast cereals with all the vitamins and minerals, because they're not in there.
Yeah. Sorry to throw a wild card at you. It was just
I'm happy to have that discussion. But I mean, that's where it's complicated, because, it makes sense to have a food source in the first place that's as close to what the animal should be eating, so you don't have to put in as many things. Yeah. But if you're feeding diets that may or may not have all those things in them, that's where supplements come into it. Yeah. Yeah.
And like you say, it can be a safer way to do it than them eating God goodness knows what.
Yeah, that's right. And I mean,
stinky.
and that's the eternal argument between natural raw food diets for pets versus fully manufactured, made by the big four dog food companies, which have got lots of science behind them, but they're still a highly modified, highly manufactured product. Yeah. It's a big conversation.
We've diverged, and it's entirely my fault.
No, it's an interesting topic. Yeah.
It is a very interesting topic. Yeah. Thank you so much for sharing your information about it. It's really fascinating. I've learned a lot.
All good.
So if you have any questions specific to how to use these with your pets, have a chat to your vet. Check out our website, vetandpetdirect.com.au. We sell a wide range of products with probiotics and prebiotics. That was a little bit of a tongue twister. And thanks for watching.
Hope we kept you entertained. Thanks, guys.
Thanks, bye.
See ya.